sure that if you guys do want to listen to our webinar again, that you can watch the recording once we are done. So welcome to our functional IASTM for healthcare practitioners. We're to the foundations and conditions for instrument-assisted soft tissue mobilization. So today we're going to spend about an hour together going through the MT blade, instrument-assisted soft tissue mobilization, a little bit about it, and how to use it into your practice. So we're going to have questions and answers as well. So I'm going to go through the whole presentation talk and make sure you guys take notes and all that kind of stuff as well. If you do have questions, we'll spend about 5-10 minutes at the very end where I can go through the questions. You guys put it in the chat box and I can answer it once we're done as well. Okay, so let's go. So we're doing the MT Blade webinar today. One thing we're also going to talk about a little bit of our customization tool. So we actually offer a great little customization product as well, where we can put your name, your logo, and you can pick your color. Here's a couple of the pictures of the customization as well. So just a little bit about our company. If you haven't heard about us as well, welcome. We're the developer of the MT Blade. We also have a kinesiology tape called Vigor Tape. We're actually moving straight to customization on the Vigor Tape as well. We develop courses on proper utilization of the MT, corrective and mobility exercise selection, and integration into your practice. We currently have 3 offices. We have an office in Burlington or Hamilton, Ontario, which is about an hour outside of Toronto, and also in Pompano Beach, Florida. And we have another one in Manila as well. We have courses for trainers, therapists, students, and doctors. Again, our website has all our information on it. You go to www.m2tblade.com. So what we're going to talk about today. So in our live courses, we go kinesiology tape, instrument-assisted soft tissue mobilization, level 1, and a certificate in advanced modalities. Today, we're going to go through our assessments. As our company, we believe in mobility and movement. We want to grade what to actually treat. So we're going to talk about our assessment protocols today, and then how that leads into our instrument-assisted soft tissue mobilization with our M2T blade. So before we ever even go into our treatment, we're always going to start off with a functional assessment. Doesn't matter if we're working with a pro athlete, doesn't matter if we're working with someone that's 90 years old, we always go through the same protocols of our functional assessment. We want to see how someone moves, what's not moving, and make it move better. So the way we do our assessment is we start off with our functional assessment. So step 1 is our dynamic movement assessment. Step 2 is going to be our treatment. So we'll take all the information we gathered out of our assessment and apply it to our treatment. And step 3 will be our correctives. We spend a lot of time doing our correctives. We're not going to talk very much about that today. We're going to spend more time on the assessment, which is our foundations and our instrument-assisted soft tissue work. But we also always want to do our corrective techniques because we're creating better mobility, and we need to retrain the brain and retrain the body of how to do that proper mobility. So it's very important to do exercises after you do the M2T blade. So just a little bit of a chart here. So on the left-hand side, we have our assess, treat, and correct. So with our system, we always spend most of our time assessing, a little bit of time correcting, or a little bit of time treating, sorry, and then a little bit of time correcting. Most protocols, when they follow it, most people are going to spend 9% of their time a little bit of assessing, a little bit of time correcting, a little bit of treatment. If you already if you have the MT blade, you'll realize that our treatment only takes 20 to 30 seconds per area per muscle. So we're really going to cut down our treatment time, but our results are improved. So let's go about our assessment. So a session should be the cornerstone of a treatment program design. A treatment should be based on one's capabilities, not just their dysfunctions and limitations. We're always going to start from a global to specific. So if someone has a shoulder pain, we don't want to just go towards the shoulder. We want to look at the entire thoracic spine, lower back, hips, and cervical spines. We're always going to start a global approach, look at how the entire body is moving, and then we're going to bring it down and look at a specific area with our blade. There are many forms of assessment, so again, we're not giving you the recipe of what to do. We're going to kind of give you a little bit of framework where you can add in your own assessment steps as well. So you can also do some movement screening, performance, range of motion, soft tissue palpation, and neurological. Once we go from our assessment, we're going to move into our treatment. First thing is always work closely with the team. So if you have team members in your clinic, work with them. Our goal is to retrain movement patterns, and then we want to focus on unilateral work. This last point, or this 5th point here, if you have a piece of paper in front of you, make sure you write this down. So this is kind of the hierarchy in what we base our entire treatment with the blade around. mobility, stability, range of motion, strength, and movement patterns. Whenever we're doing our assessment, we want to find out what's not moving and how we can make it move better. For example, if I have someone that comes in with a knee issue, we want to find out what's not moving around the knee and work on those structures first. Then I create stability. So if I go back to my knee example, most 9 times out of 10, the hip and ankle don't have proper mobility, so I'll increase the range of motion across those joints. Once I improve that range of motion, we'll go to stability. So stability within the knee, making that knee make sure it moves properly. Then I'm going to look into my range of motion, my strength, and then my movement patterns. We need to increase strength before we retrain those movement patterns. With our treatment, we're going to start off with soft tissue, which is our blade, go to our joint, then at the very end, we'll work with kinesiology taping. Last but not least is our corrective. So our corrective piece will be determined from the assessment. This is reopening those neurological pathways, reestablishing that neurological firing, and retraining the body of how to move properly. If the tissue is damaged, the body is going to compensate around that damaged tissue. So we need to retrain the body of how to move properly. This can consist of foam rolling, strengthening movement patterns, various flexibility techniques, and agonist-antagonist retraining. So a little bit of tests. So in our live course, we actually take you through a great little practical example of a muscle test with a supraspinatus. It's going to show you with compaction and with proper position. You'll show that once we do the supraspinatus muscle test and we have it in the proper position, it will be fully strong. So we're going to talk about this quite a bit across our next half hour or so, is what is mobility? Because we're always going to want to create more mobility within the tissues. So when I talk about mobility, it's not just going to be a buzzword. It's not going to be that. It's actually creating that tissue movement. So with our tool, the mttblade.com, it stands for Myofascial Mobility Tool. So our whole goal is to create mobility within the myofascial system. So mobility is the ability to move freely without limitation to normal range of motion. Example, like we just talked about, the knee with the ankle and the hip. Again, if I have a blockage at my hip or my ankle, my knee needs to move more to make up for that lack of range of motion. Okay. So let's go a little more into that dynamic movement testing. So dynamic movement testing is our form of functional movement. Our form predicts function. Your patients need to move properly in everyday situations. When we're designing treatment programs, we're going to create a logical approach. So screen, assess, test, treat, and retest. We're going to show you some baseline movements. And in this presentation today, we're going to go through our 7 exercises of what to screen and what to look for. We want to correctly identify the dysfunction. So when we're taking our patients or clients through these 7 exercises, we want to identify what's actually going to be happening. So a little bit about testing. So mobility before stability. In order for the proprioceptive system and motor control system to work properly, when something is stiff, something has to compensate. Like we talked about before, the knee. If my hip's not moving, and my ankle's not moving, I'm going to have an increased range of motion at the knee, which is going to cause some inflammation and some wear and tear around that knee joint. So when we look at our protocols, I go back to my blade work, I'm going to work on the hip and ankle first, create that mobility, then create stability within the knee. And when we talk about the actual instrument-assisted soft tissue mobilization work, we're going to talk about exactly what protocols to do to improve the mobility of the hip with the blade and improve the stability of the knee with the blade. So just a little bit of review. Everybody knows kinetic chain stuff, so we're going to give you a couple examples of kinetic chain, so how one part of the body affects another part of the body. So the body can't work in single units, we need to work all together. So if someone experiences or complains of low back pain, this is going to be the kinetic chain that we often see involved. So the hips are going to be tight. The core is going to be sloppy. So when it's sloppy, it's a little bit of a slang word for tight and weak. So our core is going to be tight and our core is going to be weak. Our thoracic spine is going to be tight. So we want to improve the mobility at the hips. We want to improve the mobility and the strength of the core. We can do that with the blade. And we want to improve mobility of the thoracic spine. Next is going to be knee. We've talked about this a few times already. So if someone experiences knee pain, ankle is going to be tight. Low back and knee is going to be sloppy, and LPHC, which stands for the lumbopelvic hip complex, is going to be tight. With the shoulder and neck pain, pecs are going to be tight, shoulder is going to be sloppy, and the scapula, those dark blue there, is going to be tight. And stretching. So we haven't talked about stretching too much because, again, when we work with the patient going through the checklist, so we're going through improving the mobility, improving their stability, strengthening, retraining movement patterns. That's going to be our checklist. By the time we fix the motor control, position, or movement error, Clear joint capsule restrictions for getting that joint to move very well, and restore the sliding surfaces to overly tight tissues. We've usually restored normal range of motion and haven't had to stretch anything. So whenever we do our course, whenever we do our online presentation, we're always asked about stretching. We don't really recommend stretching. Sometimes there is some cases where we'll have to apply a couple stretching techniques, but once you do all the proper protocols, all the proper checklists, there's not much need to stretch at all. Just to review, assessment overview. So grid starts with the posture. Again, that's always important. Everybody's already learned how to assess the posture. From there, we go to dynamic movement testing. We're going to go through those 7 exercises and the slides coming up. We're going to go to our range of motion, muscle testing, neurological testing, and then soft tissue assessment. In our courses, we don't talk too much about our neurological work at all. So postural assessment, I'm not going to spend too much time on this today. Everybody is graduated, they're doctors, therapists, so we've all done our program. So again, postural assessment, it's good to mark as well. So let's go right to the meat and potatoes of our movement testing. So our dynamic movement testing, a little bit about it here. It's 7 tests to assess the functional capabilities of our clients. We want to find those weaknesses in the kinetic chain that could cause injury, dysfunction, impede performance, and inhibit the therapy process. This is going to be our global approach. Okay, so I'm not going to spend too much time on it here. I'm just going to give you a little bit of information so you can start doing your own research and doing your own work. There are lots of courses out there about functional movement and how to properly assess, and those are really great courses with the chance to take them to learn about your assessing. Okay. Assessing is going to be the cornerstone of everything that you guys do. The best practitioners spend most of their time assessing and a little bit of time treating. Treating is easy to do, especially if you use a tool like the MCT blade, like the kinesiology tape. It's going to help move everything together. So overhead squat, we use overhead squat to assess hip, knee, ankle, and thoracic mobility. What deserves the patient to have the heels flat on the floor, feet not sliding or rotating, hips below the knees, knees over the feet, and the dowel over top of the head. Now, with this webinar, we're just kind of introducing this to you, giving you a little bit of a taste of what we do. It's really hard in this format we're teaching today to go through every test. When we do our live course, we actually go through every test, spend about an hour per test, assess, do a little bit of treating, reassess. Okay. Next one, our dynamic mobility testing, number 2, is going to be the lunge. So we're going to assess the hip mobility and stability, quad flexibility, and ankle and knee stability. Number 3, we're going to do the high hurdle steps. We're going to assess the bilateral mobility and stability of the hips, knees, ankles. We want to observe the hips, knees, and ankles aligned forward, upper body does not move, and little movement in the spine or the hips. SLR. So straight leg raise, the picture of me, one of our instructors here. So we're going to assess the assess hamstring and hip mobility. So it's a dowel placed mid-thigh, heel has to pass it. So I'm the guy in the blue shirt that's standing as the dowel, and I'm going to be the marker here. So we're also going to use this test to assess the how we can differentiate between neurological, muscle control, or joint restriction. So once we apply this test, we're going to apply a little bit of overpressure across those joints to see if it's a tissue issue, a joint issue, or a neurological issue, so we can apply our blade properly and improve that hip mobility. From there, we're going to do our seated thoracic. So we're going to assess the upper trunk rotation. We're also going to do this in rotation to the left, rotation to the right, extension, and flexion. This is one of my most favorite and important tests that we do on every patient. We want to really see how that thoracic spine moves. If we have rigidity across that thoracic spine, it can cause a lot of other issues like in the shoulder, in the neck, in the low back, and the hips and the knees. So it's one of our most important structures to make sure we have proper movement. In 2019, as it is right now, we have a lot of people on iPhones. Everybody's probably either on an iPhone watching this webinar or they're looking at the laptop. We're probably all sitting in pretty poor posture. I know I'm trying to correct my posture as I'm taking you guys through this webinar right now as well. But again, so most of our patients are going to be in that poor posture all day, so it's really important to have that proper thoracic spine. So I spend a lot of time assessing thoracic mobility through the rotation, flexion, and extension. Number 6 is going to be our shoulder mobility. So we do this to assess the shoulder mobility, internal rotation, lat tricep tie-in, flexibility, and subscap mobility. So we're going to assess all the tissues through the entire shoulder blade. Last but not least, I do this on every single client because the core is so important. I know it's kind of a cliche or we hear that a lot, but again, having somebody be able to root their core. So this is how our number 7 is testing the abdominals. See if they can actually work. We can differentiate if the abdominals work, if they don't know how to recruit them, using this exercise. So my background, I used to work with the Olympics. I worked with in the Beijing and London. I've worked with UFC fighters. We've had UFC fighters that could not pass this test. Once we retrained their core, taught them and educated them on how to actually recruit and hold their core, their performance improved tremendously. So this is a really important exercise. I don't care if they're a pro athlete, if they're 90 years old, we always want to assess their core, make sure they know how to actually recruit and hold their core. And there's lots of stuff that we can do with the blade to help recruit and hold their core as well. So once we finish our 7 assessment steps, we're going to move into our range of motion. So we're going to find the area that is of concern and go into our range of motion. So there's 3 ways we're going to test range of motion: active, passive, and overpressure. Again, when we go through our live course, we go through every single joint, how to assess it, what to look for, and how to find impingement through the tissues. Once I found my range of motion, I'm going to move into muscle testing. We want to see that range of motion. We're going to test each individual muscle to see if that muscle can actually work and move very well. Okay. So let's go into the actual meat and potatoes. I'm just going to check here if anybody has any questions or so if it is static, you can turn down. I know there's a couple of marks about it being static. You can turn down with the mic a little bit farther away from my face as well. So if you can just turn down it a little bit, it should be less static. It should be less static here now. I fixed my mic, so we should be okay. And then we will send out this PowerPoint as well. So let's go into the actual meat and potatoes of our course here. So let's talk about our actual blade work. So a little bit about our course, a little bit of a background about it. So instrument-assisted soft tissue mobilization is a new form of treatment of the fascia and connective tissues. A newly developed tool allows a therapist an extremely efficient way to locate functional disorders as well as treat them. So this tool does 2 things. It allows us to locate where those adhesions are and allows us to treat them as well. So we'll use the blade as part of our assessment steps and part of our treatment tests. So instrument-assisted soft tissue mobilization is carried out with an ergonomically designed tool called the blade. With the aid of fascial restrictions can be detected and treated. It allows a rapid localization of treatment of fibrosis, chronic inflammation, and degeneration. The ergonomic design of the blade allows therapists to track down adhesions in the fascia and treat them with reachable thrusher and thrust technique. So with the blade, we only need about 5 to 8 pounds of pressure. It's a very light, soft, gentle tool. We don't need to apply a lot of force through the actual tissues. So a little bit more about fascia, just a review. Fascia has been termed by Grotz in 1938 as a functional joint because it provides strength, structure, extensibility, and flexibility all in one. It weaves itself through muscles, ligaments, and joints. Not only that, but also the nerves, head, brain, and organs. So we're trying to treat myofascial adhesion. So fascia is connective tissue within the body. Think of your entire body wrapped in fishnet hose, both internally and externally, including each individual bone, nerve, and muscle. Over time, the fishnet hose gets entangled and require adjustment. If not, you may develop impingement. Fascia works in the same manner. So in our clinical offices, we use saran wrap. So think about all your muscle surrounded in this sticky wrap stuff. All our muscles slide and glide over top of one another. If we have any damage, friction over muscles, that sticky wrap can get stuck together, cause that impingement and cause that pain. Leading to that, if I have an impingement, I have a decrease in range of motion. We have an increase in pain. And here's a picture of a myofascial adhesion. So again, we're going to try to work with those tissues that are sliding, gliding over top of one another. Okay? So we want to improve that mobility through those tissues. So how do we fix this condition? Instrument-assisted soft tissue mobilization. When tissue is damaged, it will heal in a disorganized pattern, forming adhesions and scar tissue. These adhesions will lead to limitations in range of motion and increase in pain. So like we just talked about, if I have a decrease in ROM or range of motion, I'm going to have an increase in pain. So if I have a decrease in my mechanoreceptor activity, I'm going to increase in my nociceptor activity, which is my pain receptors. So intervention tools are used to aid in the practitioner's ability to detect these adhesions as well as treat them. We use these tools to restore the quality and functional soft tissue. This is achieved by introducing microtrauma to the tissues, increasing inflammation, and speeding up repair within the body. So, how it actually works. So, scar tissue adhesions prevent the fluid movement of muscle, tendon, ligament, and fascia. As your MCT blade instrument glides over the adhered tissues, the stainless steel tool will reverberate the feeling into our hands. Like a stethoscope amplifies the sound of the heart, instrument-assisted soft tissue mobilization tools such as our MCT blade assist us in finding the exact areas of restriction. These tools will help us break down scar tissue, and over time, this process will reduce or eliminate the adhered fibers, restore function, and decrease pain. Depending on the treatment plan designed for you, the MCT blade is used in conjunction with other techniques. We're not saying this is an all-in-one technique. This is part of what you're already doing. If you do dry needling, it's great. If you do taping, if you do cupping, if you do ART or myofascial release, this is all going to work together to improve the tissues and improve the mobility. Let's talk a little bit about the blade. So the MCT blade myofascial mobility tool is a double bevel with both a superficial and deep treatment edge. So if you look at it, if you have the tool with you, look at it in front of you. First edge with the logo facing up is cut at a 35-degree angle to assess the superficial tissues. Our tool has 8 treatment points to affect all areas of the body. We have an integrated handle for increased control and outcomes, so it can be used if you're a left-handed or right-handed person. It is made in Canada out of a stainless steel called 0.316 surgical grade. So it's not a porous material. I know there's a lot of cheap tools out there. The difference of our tools, other tools, and the cheaper tools is the material that they're made out of. The cheaper tools use a cheap stainless steel that can be harmful for your patients. So a lot of those cheap metals and cheap stainless steel will be porous, meaning you can transfer skin cells, dirt, and debris from one patient to the next. With a surgical grade stainless steel, which is a little more expensive, is going to be non-porous, smooth metal, so you can't transfer dirt, debris, or skin cells from one patient to the other. A little bit of background with MCT blades. So we're actually, in this image here, we're in 30 countries. We're actually in 55 countries. We have a course in Jordan next month. We have a course in, I'm trying to think, it's another country we just signed on. It's Brunei, and we also have Guam as well. So we have about 55 countries altogether. One of the most widely used international tools out there. And here's a picture of our blade too. This is one of my favorite pictures of a artist rendition of it. So here's the treatment points here. So it's an all-in-one 8 tool. So we have number 1 and number 2. So we use number 1 and number 2 as treatment edges. We use it for assessment and treatment. Then if you go counterclockwise, we have 3, 4, 5, 6, 7, 8. We use those to really pinpoint muscles. As we go through our live course, we go through every individual edge, how to use it, and how to apply it. We also have some secret edges here. So we have 2.3 and 1.7. So 2.3 is right where the 2 comes in 3. It's a little bit of a horn. That's really great to get in between muscles that are stuck together and have that control, precise outcome. Then we 1.7 here is going to be right where the 1 comes into the 7. So the 7 is more this horn that we come across. Number 1 comes right through here. So we can use a lot of that too to strip out. I like using 1.7 across the IT band to help loose and create the mobility through the IT band. So let's have an assessment. So again, we did touch upon assessment prior. So we talked about the global movement, dynamic movement testing before. Just to reiterate, so we do dynamic movement testing, range of motion, muscle testing. Once we finish muscle testing, we're going to go into our soft tissue palpation with our hand. Then we're going to assess with the blades. We do what's called a sweeping motion with the blade to find exactly where those tissues are adhered. Once I know my line of direction or where those tissues are adhered, I can apply treatment with the MCT blade. So let's talk about how we actually do that. We just touched upon our last slide. So we're using the MCT blade to detect faulty tissues. Once the area of interest has been narrowed down by assessment, the MCT is used to find specific areas of restriction. So it's going to be part of our assessment technique. When sweeping the MCT over the adhered tissues, there will be a tactile feedback felt through the tool into the practitioner's hand. So like we talked about at the very beginning of this section, the MCT blade is like a stethoscope to the heart, is that we're actually going to feel and hear where those tissues are adhered. Once we found those areas, we're going to treat in that same direction. So again, whenever tissues are damaged, that's called a line of dysfunction. We want to treat in the same direction of that line of dysfunction. Once we've found those areas, we want to go into our treating. So we're going to use emollient cream or lotion should be applied to the patient to help prevent skin irritation. So we typically recommend cocoa butter because cocoa butter smells good, it comes off the skin, and it's hypoallergenic. We're always going to treat our tissues from superficial to deep. So again, if I'm working on the piriformis, I'll have to work on the glute first, and then I can go into the piriformis. The MTT must always be held at a 45-degree angle to the targeted tissues. The tool can be push or pull, but only should be used in one direction at a time. Only moderate pressure through the tool is needed to affect the tissues. Like we talked about prior, 5 to 8 pounds of pressure is all you need to go through that tool. If severe rending of the patient's skin develops, it's usually decided to move on to the next area of interest. Now, stroke speed. So again, if you have a piece of paper, write this down. If I'm doing fast, short strokes, I want to facilitate the muscle. So if the muscle is not working very well, I want to facilitate it by doing fast, short strokes. If I have a muscle that's overstimulated or overactive, for example, like the upper fibers of traps, I'll do slow, long strokes. Okay? And then contraindications. So with contraindications, where it's going to be open wounds, it's going to be skin irritation, blood pressure. Age is not a contraindication. We've got to be careful that the skin may be a little bit thin, so we don't want to be too aggressive with it as well. We also want to look at hypertension or high blood pressure. We want to go a little more gentle, not go through some large areas as well. And other techniques. So intubulated used in any direction. The practitioner must assess the line dysfunction first prior to the treatment. Once the adhesion is determined, we can use the tool by using straight strokes, fanning or feathering, pinning and stripping. Now, when we do our live course, we go through each individual one of these strokes and how to actually use it and where it's indicated. And the last thing we'll touch up on here is loaded IASTM. It's something we're starting to do a little bit slowly. So we're going to treat the tissues while it's underneath a loaded force. We're doing this because our bodies are always under force. We don't want to treat it just in a relaxed, unloaded position because we want to actually treat it during the force. So the way we're going to do it is we're going to muscle test at the degree of difficulty or pain. So if I'm working at the quad, I'm going to go through knee flexion and find exactly where that pain in the quad is. I'm going to do a resistant muscle test, and as we're doing a resistant muscle test, I'm going to treat the quad at the same time doing a resistant muscle test. Why we're doing this, because the muscle may fatigue fairly quickly. We're only going to do up 10 to 12 seconds. We typically use a lot of Olympic lifters, a lot of athletes, a lot of people that are very active, because we're going to find out that those muscles can't withstand the force once they're treated. Once we do that, we're going to follow the same principles to IASTM in level 1. Yeah, that's our entire presentation today. I do know it's a lot of information and stuff that we can do. So I'm trying to read through the comments here. So thanks everybody for joining today. If we will be sending out a recording on this as well. So if you do have your email address, we will be sending it out. If you do have any questions or concerns, let's throw them in the box. We're going to try to answer them questions. If you do have a question, put it in the box. I'm going to try to answer them as best I can. Yeah, so thanks again I don't see any questions coming in. So if you do have any questions, you don't want to put it in the box below, feel free to email us at support@mtblade.com. We'll also be sending out the recording within the next hour, and we have a couple of advanced signature series MT Blade courses as well, like frozen shoulders, sports, and stroke. Thanks again for spending your afternoon or late evening or early morning, depending on where you are in the world. We really appreciate you guys learning more about the MT Blade and how you guys can practice this more in your practice. Thanks again and have a great day today.